Hi there. Thank you once again for joining me on the program, Your Doctor in COVID. I'm Dr. Mahendra Carpen. I'm the head of medical services and cardiology at the Georgetown Public Hospital Corporation. We continue our discussions around the COVID-19 pandemic, since it continues to be a problem not just in Guyana, but around the world. In Guyana, we're approaching almost 450 persons who would have died from COVID-19. So it is indeed a serious problem, and we need to continue to be vigilant, continue to do all of the safe practices that have been recommended since the beginning of this pandemic. And now we have the additional weapons of vaccination to help us fight against this COVID-19 pandemic. Remember, if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. I'm wearing my mask. As usual, it's covering nose and mouth, but I'll take it off for the remainder of this conversation. So we start off recently by talking a lot about vaccines, and I want to continue that discussion with you here today, because recently we've had an increased discussion about some of the vaccines that we use in Guyana. Right now we have vaccinated almost 230,000 of our adult population with at least one dose of a COVID-19 vaccine. And we've vaccinated almost 100,000 persons fully, that is with 2 doses of the vaccine. The vaccines that we have available in Guyana are 3 main ones: the AstraZeneca vaccine, the Sinopharm vaccine, and the Sputnik vaccine. All of them are given in 2 doses and all have reasonable storage conditions that are required, which is quite unlike the Pfizer or Moderna vaccines that require extreme cold storage of -70 degrees. And the other vaccine available in North America, the Johnson & Johnson vaccine, is a single-dose vaccine. Guyana has taken a position quite early that we would take what we can and what we have rather than waiting for what we would like to have. And what we had access to were these 3 vaccines: the AstraZeneca vaccine, the Sinopharm vaccine, and the Sputnik vaccine. We in the medical profession and others who have a vested interest have looked at the risks versus the benefits of these vaccines. We were not the first country to use these vaccines, but we examined the results of the trials that were done before these vaccines received emergency use authorization. And they have been in use in several countries, multiple countries across the world, before we in Guyana decided that this is something that we need to do here. It is important that we remember that the number 1 priority in this pandemic is to save the lives of our people. That's our priority in Guyana. And as much as we would like everyone to practice social distancing, hand washing, and wearing of masks, we know that this is not always followed, and a lot of times there are breaches that lead to rapid spread of infection. So the next thing we have in our fight against the COVID-19 pandemic is the presence of vaccines. And these 3 that we have in Guyana, they have all shown to be 100% effective in reducing severe COVID-19 infection. Severe COVID-19 infection refers to hospitalization in the ICU, being put on a ventilator, or dying from COVID-19. All of these vaccines that we have here have a 100% record of that outcome. It is quite similar to the Johnson & Johnson vaccine, the Pfizer and the Moderna, where all vaccines have a 100% record against severe COVID-19. Now, it doesn't mean that you can't still get COVID-19 infection. What it does mean is that you will not become severely ill and you will not die. And that is actually a very good initial outcome. What we have seen subsequent to that recognition is that all of these vaccines also prevent transmission from person to person. It's not 100% prevention of transmission, but it's a high percentage, sometimes in the 70s to 80% reduction in transmission from the vaccinated person to those around them. What has been our local experience? Well, it is quite encouraging to note that of all of the deaths that we have had for COVID-19, none of these were seen in persons who were fully vaccinated. No person who has been fully vaccinated with any of our vaccine has died in our COVID-19 pandemic. That's very important and very encouraging for us to know, because we have seen several persons not being willing to take the vaccine, and there are, of course, lots of questions, lots of doubts surrounding the use of vaccines. But the main outcome that we are all pleased about is that no one who has been fully vaccinated has died from COVID-19. And this is why we need to continue trying our best to get the majority of our population vaccinated to the point of what we call herd immunity. There is no fixed set definition of what herd immunity is, but essentially it means that we want about 60 to 80% of our population, and we're talking about adult population, to be vaccinated against COVID-19. And once we get to that number, then we would then have the effect of reducing transmission, reducing death rates, etc. We have seen that getting close to that number actually makes a huge difference in countries that have been able to get there. And if we look across the world, places like Israel, in the United Kingdom, etc., they are now in a position where they can allow citizens to go and mingle in public without masks if they have been fully vaccinated. There are some countries that are seeing an increase in the number of positive cases, especially when they are exposed to the variants. The Delta variant, for example, has been increasing in the UK, where increasing numbers of persons have become infected. However, they are not resulting in the catastrophic numbers of ICU admissions and death rates that we were seeing in the early days of the pandemic when persons were not vaccinated. So the vaccines are making a difference across the world. We remember the days when the United States was suffering tremendously, having to have freezer trucks outside of hospitals to store bodies. Well, as they ramped up an aggressive vaccination drive, we have seen a dramatic reduction in all of those requirements now. The number of deaths, the number of positive cases have all been falling across many states in the United States, and that is an encouraging outcome for vaccination success. And this is what we are hoping to achieve in Guyana, and this is what we are hoping to see happen in our regional partners in CARICOM and our neighbors in South America. The more persons who are vaccinated, the less likely it is that the disease will spread and continue to wreak havoc across the region. For us in Guyana, we are more concerned with our regional partners, our neighbors, etc., because that's how we are most exposed. Remember, we were discussing some time ago about the types of spread. We can have imported spread, which comes through our airports, our shipping ports, and through our land borders. So that's the imported type. We can have clusters that occur in small specific communities and households where everybody in that particular area becomes infected. But we can also have community spread where an entire region, for example, there are lots of positive cases circulating in that community and passing it on from person to person. Right now, we have recognized that one positive COVID-19 person has the potential to spread it to between 2 and 3 others. So it is still a big problem. And once there is that number greater than 1, there is still a potential that this pandemic could continue to grow out of control. So we need to do whatever we can to be able to stem the tide of increasing cases and, of course, increasing death from COVID-19. So persons have had several questions, some being addressed to me personally, some sent to me via secondary contacts, etc. And a couple of the constant and very probing questions had to do with pregnancy and breastfeeding. We have discussed this at length before, and it is very, very clear what the recommendations are around the world by all of the authorities responsible for this. The consensus position is that there is no reason to deny a pregnant woman the COVID-19 vaccine. No reason to deny vaccination because of pregnancy. The same is true for the breastfeeding mother. There is no reason to deny a breastfeeding mother the COVID-19 vaccine. Across all populations, the only reason that persons should be concerned about not taking the vaccine is in that small group of persons who have a history of severe allergic reactions. Severe allergic reactions refer to persons who develop allergies that result in them not being able to breathe, them having to go to the emergency room, needing adrenaline shots, needing to be admitted to hospital. All other persons, the heart patient, the dialysis patient, the diabetic patient, the asthmatic patient, the seizure patient, all of these patients are therefore eligible for the COVID-19 vaccine. None of these routine or common medical conditions should be used to prevent these persons from getting vaccines. I still get patients coming to me asking if they can take their vaccine because they had a heart attack 2 years ago, because they have heart failure, they're on these medications, etc. Well, these are actually the high-risk patients for death from COVID-19. And these are the persons who should actually be at the front of the line to get the COVID-19 vaccine. Remember when we started our program in Guyana, we started with vaccinating the healthcare and frontline workers, and then that moved to the elderly and then those persons who have comorbid conditions. There has been no change in what we know or what we saw from the early days. Persons with comorbid conditions continue to be high risk for bad outcomes from COVID-19. So therefore, whatever we can do to protect these people, we need to take those steps. And these steps remain the simple ones, like washing hands, social distancing, and of course wearing masks, particularly when you're out in public or in groupings that are not considered to be your normal social circle. And now in 2021, since March of 2021, Guyana has started an aggressive and very commendable vaccination drive. And I want to take this opportunity to salute all of the primary healthcare workers, all of the nurses, the medics, and all of the persons involved in administering vaccines to our population. We have over 100 sites across the country doing vaccination, and we also have these vaccination drives where we have people going to specific locations on a weekend, etc., to vaccinate the people. So I want to take this opportunity to salute all of those involved in those efforts, and thank you once again for all of your efforts in getting the people of Guyana vaccinated. Remember, if you have any questions or comments, please feel free to send a WhatsApp to 620-6275 or send an email to docandcovid@gmail.com. Thank you once again for joining me.